Thanks for joining me for this video presentation where we're going to discuss the essentials about lumbar puncture. I am a physician at Toronto Memory Program. I work in our memory clinic as well as in the research program where I'm known as a research investigator. I do, along with one of my colleagues, the majority of the lumbar punctures that are part of our clinical trials. And today we're going to talk about why we do them and so that you can understand in advance what's involved, because there's a lot of anxiety around them. Justine Reum, who is the manager of clinical trial recruitment, might be someone that you might be speaking with at some point, but she's helped with this presentation because the second half of it will be an interview with someone who had a lumbar puncture to discuss their experience. So this is the agenda. What is a lumbar puncture? How is it helpful in Alzheimer's disease? How do we perform the procedure? All the procedures are performed here, by the way, at Toronto Memory Program, which is in the York Mills and Leslie area. We're going to talk about what are the risks of doing the procedure and the patient's experience. So the procedure's done to access the cerebral spinal fluid. So this is the fluid that bathes both the brain and the spinal fluid, the spinal cord, and it contains many different proteins that are produced by the brain, but may not be used or may be finished in their task. And all of these different proteins and markers can be measured in the spinal fluid, and whether that's to do with Alzheimer's disease or other conditions that we'll talk about. This lumbar puncture procedure is actually different than an epidural, which you might be aware of as a way to provide anesthesia. So if you've had a child, you may have had a epidural done in order to deliver medication, to give you freezing to numb you up so you wouldn't feel anything, or sometimes when you're having hip surgery, the hip replacement could be done under an epidural. And in this case, the needle doesn't pass into the spinal fluid. It goes adjacent to the spinal fluid or outside of the dura. But it's a similar process of putting a needle in the spine. And why do we do lumbar punctures in general? Well, if you come to the emergency department and we're concerned that you have meningitis, then we're going to do the lumbar puncture because we need to collect some of the spinal fluid to determine which bacteria is responsible. In the past, we've used lumbar punctures to make diagnoses of other neurological conditions like multiple sclerosis, because again, we can measure certain features in that spinal fluid. We do them to research into the action of different medications on the brain to see perhaps what's the concentration of that medication after we've given it. And we also use it to deliver treatments to bypass what's known as the blood-brain barrier. So the brain is very protected. It has kind of a very tight seal around it, and that's to help prevent bacteria and other bad things from getting in. But it also prevents certain medications from getting into the brain where it's necessary. So if we want to bypass that by giving the treatment directly to the tissue of the brain, we'll do it by injecting it into the spinal fluid. And then we can give a much lower dose because we don't have to get it past a barrier. So how is this lumbar puncture helpful in Alzheimer's disease? Well, the nature of the disease is it's an accumulation of two pathologies, among others, but the main two are from a protein known as amyloid, which forms plaques in the brain, and another protein called tau, which forms tangles. So if you read about the disease, you'll read about plaques and tangles. Now, amyloid is produced from brain cells, and initially when it's produced, it's free and floats around, or it's soluble, we would call it. And so it's in the spinal fluid, and we can actually measure the amyloid protein. These individual strands of amyloid protein eventually clump together, and they form an insoluble version, or the plaque, where the amyloid then settles onto the surface of the cells, and it in turn causes damage to brain tissue. In fact, the part of the amyloid that's soluble also causes damage to the brain. But we can measure this in the spinal fluid, and that tells us about what's going on with Alzheimer's disease. Tau, on the other hand, is a protein that's normally found inside neurons. It has a very important feature. It helps to provide a skeleton for the neurons so they maintain their shape and helps to deliver some of the neurotransmitters that our brain use. But when neurons are damaged, then this tau and specific versions of it known as p-tau or phosphorylated tau are released into the spinal fluid as the cells die. So they normally shouldn't be there, and if we find them in the spinal fluid, that also gives us an indication that this Alzheimer's pathology is taking place. So amyloid and tau levels are measured. And knowing these levels can help us with diagnosing Alzheimer's, because it's not historically something that we've been able to access. So lumbar punctures are not yet at the point where they're used in regular clinical practice for diagnosing Alzheimer's, but in research we do use that. And in research, it also helps us to monitor a treatment efficacy. So we want to see, well, are brain cells being less injured, or there's less inflammation, or fewer amyloid proteins are being formed. We can measure that in the spinal fluid as a study progresses. So this is a diagram that shows you on the left-hand upward axis the biomarker abnormality, or the level of abnormal levels of biomarkers, and across the bottom time. And that time is actually about 30 years altogether. And what you see on the left-hand side, that first line that's going up from the bottom left-hand corner to the top right, is the cerebral spinal fluid levels of amyloid. The second line is a special picture that we can sometimes take, a PET amyloid brain scan, where we can actually see amyloid on the brain cells. And the third line is the spinal fluid level of the tau protein. And what's important to see here is that these levels go up even before people have symptoms. So that shaded area that you see towards the right half, where it says normal, mild cognitive impairment, and dementia, these spinal fluid markers are elevated even before symptoms arrive. So we can detect Alzheimer's changes ahead of time, and we do that as part of our prevention studies. All right, so how is a lumbar puncture performed? Well, first we tell you all about it, both ahead of the procedure and at the time of the procedure. Either I or my colleague goes over exactly what we're going to do. Some people have asked about, can I take something ahead of time if I'm anxious and can't manage, and that's something we could certainly discuss, whether you take something like what you take before an MRI. I find that most people don't need anything, but certainly that's something we can discuss. And usually what happens is after the procedure, people sort of do that's all it was, and are kind of relieved that it wasn't nearly as anxiety provoking as they dealt with beforehand. So the procedure's done generally at our center with the person sitting. So you sit on a bed and you rest your hands on a sort of table, and you put your head down, you make a nice little curve in your back, and that's about the most work you have to do. The other way we do it sometimes is lying on the person's side, where they bring their knees up to their chest. Again, that makes a nice little curve, and the whole purpose is to make a gap between the vertebrae, because that's where the needle's going to go. Then we do a coating or two of iodine and alcohol to clean off the area. And then the good part, of course, we do freezing. So we numb up the spot where we're going to do the procedure. And that's really just to numb up the surface of the skin, and just a centimeter or two in where we're going to insert the collecting needle. We actually use a little guide needle into that spot, just so we know we got the right line between the vertebrae. And then we insert into that a little round-tipped collection needle. Now, the round-tip part is important because when we use that, it's basically pushing through tissue. It's not traumatizing it the way a sharp needle would be. So if it were to come in contact with anything like touch a nerve, it might cause a little local irritation, but it's not going to cause any damage, and we just reposition the needle. So the side effect profile has gone down since we've switched to these round tip needles. When the fluid comes out, it's coming out as a very slow drip. Kind of think about a faucet that's just slowly leaking. So it takes a while actually for us to collect the fluid, and depending on the volume of fluid, that dictates the length of time. So it could be anywhere from 5 minutes to 15 minutes if a study says that it needs a certain quantity. And your body makes this fluid very quickly. It's constantly replacing it because it serves an important function to rinse off the brain, to keep all the proteins it doesn't need away from the brain. And during the procedure, we have a nice conversation. You tell me stories, I tell you jokes. We try and make it as relaxing as possible. The needle comes out and a Band-Aid goes on, and we usually keep you around for about 20 minutes just to make sure you're feeling okay. And then you go. And that's it. There's some restrictions after we do the procedure. We like to keep the area dry for about 24 hours. So we just suggest don't shower or bathe. And we don't want you doing heavy physical labor or hard workouts, but you can drive home and you can go for a walk. Any of those things are perfectly acceptable. So people are always worried, my God, what are the risks? They're sticking a needle in my back. That's so scary. Well, there might be some local discomfort or pain because we're putting a needle in, but we mitigate against that by giving you the freezing. There's a risk of local bleeding or infection, but really the risk is not different than if we poked a needle into your vein in your arm to collect blood, in terms of the frequency that this might occur. So it's quite rare. The thing that we warn people about is what's known as a post-puncture headache. It can occur anywhere from 1% to 4%. It depends a little bit on the size of the needle, but we use a very small gauge needle. And again, that round tip, so the frequency of this is less. And the reason why people might get this is after we pull the needle out, usually the hole just closes right up. But if for some reason it takes some time to close, then what you've got is you've got a column of fluid with a hole at the bottom. So there's a pressure gradient between the top and the bottom, and where you'd experience that is as a headache. So the headache tends to be postural. It's there if you're upright or if you're standing around and walking, and then you lie down and literally within a few minutes, the headache's gone. And so that's actually the treatment for it. We have you lie down, rest, reclining or flat, have some fluids, Tylenol if you need it. You don't have to stay reclining. It just helps with the healing process. It rarely requires any additional treatment. And the majority of these resolve anywhere from 1 to 4 days. And we monitor you, meaning we keep a close eye. We have you check in with us just to see how things are going. And if there's any issues or concerns, then we would deal with them. People are worried about, well, what about my spinal cord or nerve injuries? Well, in fact, your spinal cord ends a number of vertebrae higher than where we do the procedure. So we're nowhere near your spinal cord. It does not cause paralysis. As far as nerve injury, it's exceedingly rare, especially with these atraumatic needles that we use, as I described before. Those are the main side effects. So now we're going to have a little presentation from one of the people who did the procedure here with us, and they'll walk you through their experience, and hopefully this will help to reassure you that this procedure in our hands is a common practice, and we're quite expert at it, and is something to consider if it's part of a study for you. Sometimes we call the spinal fluid liquid gold because it contains so much information that's important to learn about the disease, and also for the patient to learn about their the makeup of their spinal fluid. So thank you very much for listening.
So for me, the procedure was very simple and easy. I was confident in who was doing the procedure to me. They walked me through it very matter-of-factly, and it was just very simple and easy. There was no pain. I felt like a bit of a pinch, I would say. And after that, it was a little pressure, and then he said it was done, and that was it. The doctor that did the procedure was very articulate, walked me through the whole procedure, ended up telling me exactly what was going on at every step of the way and when it was completed, and gave me follow-up information when it was done. There was I think there was nothing other than I think in my own head, I probably made it out to be worse than it actually was. So it was nowhere different than getting some blood withdrawn. I would say it was a lot less than what I expected, especially when you hear it's going to be a puncture and it's going to be in your spine. It's going to be much worse than what you're expecting. You're thinking it's going to be much worse. It was a pinch and a little bit of pressure, and that was it. And as soon as it started, it seemed to be very shortly after finished. For me personally, I had no follow-up problems at all. They told me what to do if there was, but I had absolutely no problems, and it was good. I think the key thing is to trust the person that's doing it for you. They're trained professionals, and I know when I talked to the person who was doing mine, they told me how many thousands they had already done. So that made me feel very comfortable with what was going on. I think the key reason I decided to do this was because my mom having the disease, and having had grandmothers who've gone through this disease, I know what kind of future it does bring, and I think it's great for my family to know, especially my partner, to know what future was for us. I also thought for me personally that if doing it at a younger age, if I found out that I was positive, that I'd be able to get on it much sooner than waiting until I was starting to show more signs.